So I'm going to display how we examine the shoulder with the ultrasound. First, we find the biceps tendon, and that's a cross-section of it in the groove of the humerus. You can identify the subscapularis tendon by having the patient externally rotate his hand. So just keep your elbow up. There you go. And come backwards. That is subscapularis, overlying the biceps tendon. Moving upwards and medial, you see the glenohumeral joint, the anterior view. Coming lateral, you can identify the humeral head underneath the acromion, and when you turn it 90 degrees, you should be able to see the supraspinatus tendon and the subdeltoid bursa, which is the black line above the tendon. Lawrence, can you extend your arm to the side? And you see the tendon disappear underneath the acromion. You can put your arm down, and you can access the subacromial space through this view as well by just going between the tendon and the acromion. Posteriorly, you could find the humeral head, and you can identify the infraspinatus muscle inserting on the humeral head, and ask the patient to rotate his arm again, and you'll see the muscle and tendon move with the bone. Going medial, you'll find the posterior joint capsule, and that's at the center of the screen. Okay, now we're going to find the suprascapular nerve and perform a suprascapular nerve off. I'll tell you when the pinch is, okay? Just pulling you off. Okay, so the first muscle layer is the trapezius and the supraspinatus is underneath. The suprascapular nerve is under the transcapular notch, and there's a blood vessel next to the nerve which you may or may not see. So give me a quick pinch on it, okay? Pinch. You can see the needle coming in, approaching the region of the nerve, right above the ligament. Almost done. You okay?
Mm-hmm.
You may feel some pressure in the shoulder while we're working. I'm giving a little anesthesia above the ligament. I'm going to pull back the needle. I'm going to take a different angle to get more proximal. And I'm going to pierce the ligament again to move a little bit further from the nerve, but still get the anesthesia in the proper location. There we go. See the needle tip above the nerve and blood vessel. You alright?
Mm-hmm.
Breathe.
Almost done. Yeah, you can breathe.
I'm breathing.
Don't hold your breath.
Good.
I'm breathing.
Into your
I'm trying not to move.
You're doing great.